A comprehensive pediatric assessment requires the evaluation of hundreds of discrete behavioral, motor, and linguistic data points. Attempting to commit this volume of disconnected facts to rote memory creates a high cognitive load. Under the pressure of a board exam or a fast-paced clinical encounter, isolated facts are often the first to be lost. Organizing these milestones into a chronological matrix provides a logic-based scaffold. It moves the information from a list of fragmented data points into a predictable sequence. By mapping specific milestones to phonetic and numeric anchors, we can categorize years of neurodevelopment into distinct, manageable blocks. This system ensures the information is organized linearly, matching the forward progression of a child's biological age. When developmental data is structured this way, it aligns with the natural workflow of a clinical exam, shifting the focus from memorization to observation. The first 6 months of life are defined by rapid physical gains. To navigate this phase, we use a series of simple phonetic anchors. At the 2-month marker, we apply the 2C rule. The first C represents chin up, marking the acquisition of early cervical motor control. The second C represents chase face. This links the onset of visual tracking with the emergence of the social smile. At 4 months, the anchors transition to the 4H rule. The first H tracks the progression of head control, where the neck becomes fully stable. The second H represents hand reach, marking the beginning of purposeful fine motor coordination. The third H signifies ha-ha, the point at which an infant begins to laugh. By 6 months, development is governed by the 6S rule. The first S identifies core stability, or the ability to sit with support. The remaining milestones include switch hand, crossing the midline, and a transition to social engagement, where the infant will smile to everyone. These phonetic rules follow the actual proximal to distal maturation seen in the first half year of development. As mobility increases around 9 months, the milestones become more complex, requiring a shift to visual and numeric metaphors. At the 9-month node, we use the spider baby metaphor. Like a spider, the infant now crawls and can sit on a web, meaning they have achieved independent sitting. This is also when the spider sees a stranger and cries, representing the clinical onset of stranger anxiety. Finally, the spider picks up a fly, symbolizing the development of the immature pincer grip. At 12 months, we utilize the 1-1-1 rule. 1 year, 1 word. 1 object picked up with a mature pincer grip, and 1 independent step. By 18 months, the toddler experiences a simultaneous surge in both motor independence and vocabulary. The number 18 correlates to vocabulary size, with the clinical standard being approximately 10 to 20 words. We also track 3 specific physical actions that begin with the letter S. These are scramble, spoon feeding, and squatting, the mechanical precursor to running. These metaphors allow us to track the transition from an immobile infant to an increasingly independent toddler. From ages 2 through 5, the matrix focuses on yearly intervals to track sophisticated linguistic and social milestones. Year 2 is defined by the number 2 and the double L rule. This includes 2-word phrases and the gross motor milestone of 2 feet go, or proficient walking. The double L's signify kicking a ball and parallel play. At year 3, the number 3 maps to speech, transport, and geometry. 3-word sentences, riding a tricycle, and drawing a circle. Year 4 utilizes the phonetic F rule. This captures the use of full sentences and the start of friend play, or interactive social engagement. Motor skills at this age include foot jumping and following across, the ability to draw intersecting lines. Finally, at year 5, we use the 5 points of the STAR acronym. S for skipping, and T for drawing a triangle, A for amazingly fluent speech, and R for rule-based play. Tracking the progression of geometric drawing, from circle to cross to triangle, provides a reliable baseline for fine motor and cognitive maturation. The completed matrix provides a single, unified view of pediatric development from birth to 5 years. By viewing these milestones as a sequence, we can follow specific skills as they evolve, such as watching a simple hand reach at 4 months mature into the ability to draw a triangle at age 5. This structure allows for the rapid identification of specific developmental tracks during an assessment. While neurodevelopment is a fluid process, these anchors provide the necessary benchmarks for clinical evaluation. For high-stakes examinations, this logical organization supports accurate recall by linking facts to a predictable chronological arrow. In a fast-paced clinical setting, it allows the attending physician to quickly categorize their observations within a standardized developmental framework. By anchoring milestones to these phonetic and numeric rules, the clinician creates a consistent system for monitoring development and identifying potential delays.